Well, good afternoon, everyone. Good afternoon, and welcome to Nurses Hall. We are appropriately in Nurses Hall, a hall in this great state house that honors healthcare providers, and today that is what we are doing, and that's what we're here to announce. I'm delighted to be joined by many of my colleagues in the legislature, some of whom you'll hear from shortly, as well as so many caring and skilled providers and provider organizations who fundamentally are just in the business of taking care of people. It's as simple as that. Today we're here to sign the strongest law in America that will protect reproductive health care, gender-affirming care, and those who provide it. Days like today make me even more proud to be from Massachusetts and to be a governor of this great state. I want to express my gratitude to so many for their leadership and their partnership. That's Senate President Karen Spilka, Speaker Ron Mariano, the entire legislature, including Chair Cindy Friedman of the Health Care Financing Committee, Representative Mike Day of the Judiciary Committee, Chair Bill Driscoll of the Public Health Committee who's with us. We're also joined, I know, by Senator Sear, Rep. Stanley, among others. I want to thank leaders in my administration on this issue, including our Secretary of Health and Human Services, Dr. Kiame Mahaniah, Beth McLaughlin, who's General Counsel, the Department of Public Health, on behalf of our Commissioner, Dr. Robbie Goldstein. I also want to thank Attorney General Andrea Campbell for her leadership, and I'm delighted that we are joined by members of her team in the Reproductive Justice Unit of the AG's office, including Allie Slater. We have advocates, providers, and partners, including Dr. Nicole Smith of Brigham and Women's Hospital, Claire Teluni of Reproductive Equity Now, Julia Keogh of Health Imperatives, Dallas Duker of Fenway Health, Carol Rose of the ACLU. So this year, Massachusetts, we were ranked the #1 state in the country to raise a family, the #1 state to have a baby. That happens because of good policy and good work by a lot of people. We've also been ranked, as you know, the #1 state in the country for health care. A big reason for these things is because in Massachusetts, you have the freedom, you have the choice, you have the free will to make health care decisions for yourself and your family. I think that's so fundamental, that freedom. I think it's something that everyone should have and that everyone around this country should be able to benefit from and everyone should deserve. And in Massachusetts, we're guaranteeing it. We're guaranteeing it. That's what today is about. Because we know across this country, reproductive rights and health care remain under attack. Gender-affirming care is under attack. People in our communities and our families and our providers are under attack. 1 in 3 women in the United States of America lives in a state where you can't get an abortion. 1 in 3 women. Abortion bans are in place. The majority of those states have no exceptions for rape or incest. Now, the dedicated, compassionate people who provide this health care are also under attack, vicious attack. Not just in those states either, because they are reaching across state lines to target our very own providers. That is something that we will not stand for now or ever. Because in Massachusetts, we believe in freedom. 250 years ago, we invented freedom for this country, and we know that freedom includes the right to health care, the right to be free from unnecessary interference by government or anyone else. Those rights, those freedoms are not negotiable in Massachusetts. We will protect them, we will defend them. That's what we've done for years. When you think back to when Roe versus Wade was overturned, We passed the first SHIELD law in the country. We defended access to birth control and medication abortion. We ensured access to emergency, life-saving health care. We expanded access to doulas and birthing centers. And we provided funding for reproductive health programs in parts of our state where access was limited. The SHIELD 2.0 is a necessary step forward. It strengthens access to care, it bans discrimination, it protects the privacy and the safety of those seeking reproductive care, gender-affirming care, and also those providing the care. It protects them here in Massachusetts, and it protects them against attacks coming from outside of our state. No one is going to come to Massachusetts and attack our people, attack our institutions, attack our providers, because we believe in freedom. It's why we've continued collectively to take action, and we will continue to take action as necessary. We owe it to the people of Massachusetts, and you know what? We owe it to Americans. We owe it to this country. This week, we welcomed some legislators from Texas to this very State House. Legislators who were fighting to protect the voting rights of those in Texas, the voting rights of all Americans. Because what happens in Congress affects people in the Bay State and every state around this country. And that's why we join with them in solidarity in their fight to protect democracy, to protect voting rights. The same is true when it comes to reproductive rights. What we do to protect people's rights here in Massachusetts impacts the country. Providers in Massachusetts, brave, dedicated healthcare professionals, are helping women and people in other states. This law protects them, and it also sends a message. It shows a way forward to a more free, fair, and healthier future for America. I want to thank everybody, first of all, who's in the trenches doing the work day to day. I am so saddened and horrified to see you under attack, to see you threatened, simply for wishing to fulfill a Hippocratic oath of taking care of people. I'm the daughter and granddaughter of a nurse, and I respect our healthcare providers who are there doing the work, providing at times life-saving, critically important care. And I appreciate the work that's been done to make sure that we are utilizing everything possible to make sure that we protect our providers, protect people who need care, and fundamentally, in the face of all sorts of efforts to undermine American democracy, the rule of law, liberty, freedom, things that people gave their lives for right here in Massachusetts 250 years ago, I am proud that Massachusetts is once again standing up in this moment to be a beacon to others around the country, to be hopeful, to be optimistic, and to affirm what is right and good about the United States of America and the Commonwealth of Massachusetts. And with that, I want to invite to the podium a person who has been a champion for protecting rights and freedoms, including on this very issue of accessing health care, and that is Chair Cindy Friedman. Woo.
So everything she just said, okay? Just not a lot more to say. So thank you, Governor Healey for bringing us all together today and for your unwavering support for reproductive and gender-affirming care and protections and for signing this bill into law. Legislators from across the country came to Massachusetts today, convened in Boston, and we did in fact find common ground with our counterparts. A shared topic of conversation from legislators across the country is where the state's autonomy is and where it stops amidst the actions of the federal government. The legislation before the governor today is fundamentally about protecting our state from those outside who wish to decide how we in Massachusetts choose to deliver health care and the values we decide should drive that care. And whether you agree with these issues or not, whether you're pro-choice or not, whether you have issues about the kind of care that's provided, nobody outside our state should get to decide that. Nobody. And we get to decide that care. We in Massachusetts, we get to decide that care. We sit down together and decide what our values are. Not Texas, not Missouri, not the federal government. It's us here in Massachusetts. States across the nation have continued actually to look to us to see what we're doing to provide these vital protections. And part of this bill comes from the fact that there are numbers of states that have adopted what we've done in SHIELD 1.0. They've worked through it. They've come up with some more good ideas, and we've found some loopholes. And we're going to make sure that we close those loopholes, that we protect our providers first and foremost, and the women and people who are seeking reproductive care and gender-affirming care, that we don't put them in harm's way, that when you come to an emergency room because you are having an emergency and you are pregnant, that you get that care, that nobody turns you away, which is what's happening across the country, because people are so afraid of whether they're crossing the lines of these draconian, horrible, anti-women and anti-transgender laws that are going into place. This bill addresses those issues. And we will continue to be at the forefront of healthcare policy. And I have to say it is in large part due to the leadership of this state. If you don't think leadership matters after the last 9 months, you probably are living under a rock, but this is how we see how leadership matters. There was a totally coordinated effort to provide our residents and our providers with protections that they need. Included in this effort was our Attorney General, Andrea Campbell, and her office. They are so phenomenal. They need a round of applause. I would also like to thank the Department of Public Health, especially the Commissioner, Robbie Goldstein, for his collaboration. They were there at the table all the time, helping us work through these very complicated issues of where a state's authority stops and where the federal government has authority that we can't overstep. So I want to thank them enormously for their help. And I am so thankful for the collaboration and partnership with our advocacy allies at the ACLU of Massachusetts, Planned Parenthood, League of Massachusetts, Reproductive Equity Now, and GLBTQ legal advocates and defenders, CHIA, and countless other individuals who worked on this legislation. When everybody comes together, when you set the values that you are trying to protect, people put their shields down, and they really work together. And they stop thinking of their individual little pieces, and they think about everyone. And what you get is something like the SHIELD Law 2.0. And I would finally like to thank the Judiciary Committee co-chair, my co-chair in the conference committee, Chair Mike Day. He was really great to work with. It was very clear that this was a priority for the Senate and the House. We got through that really quickly. and we're always on the same page. And I'd also like to acknowledge the Judiciary Committee co-chair, Lydia Edwards, who moved this bill expeditiously. And finally, of course, I want to thank the Senate President for her commitment to responding swiftly and strongly to all of the unprecedented and unpredictable, deplorable actions of the federal government. I'm so happy that both the Senate President and the Speaker made this particular legislation a priority. And, of course, to all the providers giving care, to the parents navigating the system to ensure their child is supported, and to the patients advocating for their own health and safety. We will do everything we can to continue to have your back. This is not the end, it's not the be-all. We'll continue to watch what's happening at the federal level and in other states and respond to upcoming threats. It is our continued commitment to always, always keep the health and safety of Massachusetts residents at the forefront of our work. Thank you so much. And now I'd like to invite Dr. Nicole Smith, an OBGYN and previous partner in other efforts at Brigham and a member of the MA Medical Society, to the program. Thank you so much.
Good afternoon. My name is Nicole Smith. I'm an obstetrician and the Vice Chair of OBGYN at Mass General Brigham. I'm here today also representing greater than 20,000 physicians of the Massachusetts Medical Society and the Massachusetts branch of the American College of OBGYN. Across the country, providers of reproductive and gender-affirming health care are working tirelessly to preserve the health and well-being of their patients, unfortunately at great personal risk. Our patients are losing access to evidence-based care, and they're frightened, and so are we. Unfortunately, those out-of-state threats have begun to impact providers and patients in Massachusetts who are worrying about how the care that they provide here at home may threaten their safety either in the future or if they travel out of state. This law sends a strong message across the Commonwealth, affirming our state government's commitment to protecting access to life-saving, evidence-based care. The SHIELD Law 2.0 strengthens critical patient privacy protections while achieving the right balance, one that promotes safety and trust while supporting exceptional clinical care. It truly reflects the very best of what medicine and the Commonwealth stand for: autonomy, dignity, and the right to timely, safe, and respectful care. So on that note, I truly want to extend my sincere thanks on behalf of myself, my institution, the Massachusetts Medical Society, and the American College of OBGYN, to Governor Healey, Attorney General Campbell, Speaker Mariano, State President Spilka, Senator Friedman, Chair Day, the legislature, and every advocate who made this moment possible. We applaud you for defending these values and ensuring that Massachusetts remains a beacon of access, humanity, and high-quality care where providers and patients can be safe from intimidation. Today, we can say that the government's got our back, and we really appreciate it. So we're honored to stand with you, and we look forward to continuing this work together. And next, I'd like to introduce Dallas Duker, the Executive Vice President at Fenway Health. Thank you.
Thank you, Dr. Smith. It's a true honor today to celebrate a law that will save lives, including my own, and so many other trans people who I know, so many trans kids out there who go to Fenway Health every day, among so many other organizations, and receive life-saving care. This law will save families, it will protect families, and remind our country what leadership looks like. A deep thank you to Governor Maura Healey, to Senator Cindy Friedman, and every single advocate, policymaker, and survivor who made this possible, who raised their voice and made today possible. With this law, Massachusetts is not just responding to a crisis, we're rising to meet it with courage, with clarity, and with conviction. At a time when gender-affirming care and reproductive care are under attack across the country, this Commonwealth has made something crystal clear. We will not back down. Our government will protect our providers. Our leaders will protect our patients. And we will be a refuge to protect the fundamental right to health care, no matter who you are or where you come from. This law does what our systems too often fail to do. It wraps care providers in protection rather than suspicion. It lets us focus on healing, not legal threats. It defends clinicians from politically motivated investigations. It strengthens data privacy, ensures parents won't be punished for loving their children. It ensures healthcare won't be weaponized. This isn't just policy, it's a principle, and it's a declaration that this Commonwealth will be a beacon. That when others turn away, we open our doors. And that when others sow fear, we stand in solidarity. This law is hope made real, so let's celebrate it, let's defend it, and let's help lead this country forward. Thank you all so much.